When it comes to Medicare supplement insurance, there certainly are a lot of different choices. After all, there are 10 different Medigap plans to choose from. So which one do you enroll in? Well, one of the plans you may have heard of is Medicare Supplement Plan G. After all, Plan G has almost 100% coverage, but is it the best plan for you? Well, in this video, I'm going to discuss what Plan G covers, what it doesn't cover, and an alternative to Plan G that could save you even more money. So stick around. Now, my name is Russell Nogo with Medisupps.com, and welcome to our channel. For the last 15 years, we've been helping people with their Medicare supplement insurance because it's very confusing. So, if at any time during this video you've got questions or afterwards, jot down the phone number below. You can call us, and we would love to talk with you and answer all of those questions for you. So let me start by explaining why you might even need a Medicare supplement plan to begin with. Now, Medicare, or original Medicare was what it's called, consists of two different parts. They are Medicare Part A and Medicare Part B. Medicare Part A covers hospitalization. That's inpatient services if you go into the hospital. Medicare Part B covers doctor's services. Those are outpatient services. Both of these have what are called gaps in them. And gaps are expenses that you're required to pay or your Medigap plan pays for you. That's where the term Medigap comes from. It helps pay some or all of those gaps. So what are some of the gaps? Well, let's stay with Medicare Part A for a moment. If you go into the hospital and you have Medicare Part A, you're going to get charged a deductible. That deductible is $1,632 for 2024. But it's not an annual deductible. This is if you visit the hospital, you're admitted to the hospital, you will need to pay that. But if you leave for 60 days or more and you go back into the hospital, you have to pay it again. Now, Medicare Part A hospital insurance also has coinsurance after 60 days. On days 61 to 90, you'll have coinsurance you need to pay. That's $408 a day for 2024. And so you see how these expenses could really add up. A Medigap plan can help pay most or all of those for you. So another thing that is covered under Medicare Part A is skilled nursing facility. If you leave the hospital, go into a skilled nursing facility, Medicare will pay up to 20 days. Beyond that, a Medigap plan, one of the more popular Medigap plans, including Plan G, will pay up to 100 days in a skilled nursing facility. So that can get pretty costly if you have to pay that coinsurance on your own. So now we'll move over to Medicare Part B and what's not covered there. Well, Medicare Part B has its own deductible as well. So if you visit the doctor, again, we're out of the hospital, we're outpatient services, and you visit the doctor, you will have to pay a $240 deductible in 2024. Now, how does this work? Well, let's say it's January 1 and you visit the doctor, you will get billed the first $240 of your medical bills. And then when you meet that deductible, Medicare Part B will come in and pay 80% of your doctor's bills for the rest of the calendar year. So the one gap in Medicare Part B is that deductible. The other gap is that 20% coinsurance, which you're required to pay for the rest of the year. The good news is with Medicare Supplement Plan G, you do pay that Part B deductible. And again, that's $240 for 2024. But after that's met, Medicare Plan G comes in and pays the remaining 20%, as well as every other gap in Medicare Part A or Part B for the rest of the calendar year, which means on all Medicare approved expenses, you get no medical bills. Now, Medicare supplement plans follow Medicare wherever it goes. So what that means is there's no network. Medicare is a federal program. It's all over the country. A Medicare supplement plan will come in and do just that. It supplements Medicare. Unlike a Medicare Advantage plan where you typically have a network, an HMO or a PPO, or maybe you're used to that with your employer coverage that you had. Well, that's gone. Medicare federal program, any doctor, specialist, or hospital in this country that accepts Medicare will accept your Medicare supplement plan. Now, Medicare supplement policies are offered by private insurance companies. Many different ones you may have heard of. There's Humana, Aetna, Mutual of Omaha, Allstate, all the big names. A lot of them, depending on the state, offer Medigap plans. These plans are what's called standardized. And what that means is the federal government comes in and says, okay, we're going to standardize these plans, which means every company must offer the exact same benefits within each plan letter. That means if it's Medicare Supplement Plan G, doesn't matter which one of those companies I listed or even the ones I didn't, they all must have the same benefits in Plan G. It all covers the same thing. However, each company charges different rates. So yes, you have heard me correctly. You can pay substantially more for the same coverage depending on which company you pick. Sounds like fun, right? Well, it's actually not. If you try to shop these plans on your own, and you most certainly can do that, you would have to call every single company separately. You would get a sales agent on the line, and that sales agent works just for that one company, which means they're going to try to sell you their company's Plan G or whichever plan letter you're interested in. When you go to ask them, what are the rates from all the other companies? They will say, we don't know, we don't care. Do you want to buy our plan? So in reality, they work for them, the insurance company. That's their job. That's normal. But it doesn't give you all the other options. You have no idea how much every other company is charging for the exact same thing. So there's no reason to pay anymore. We're an independent agency, so we shop all the top companies for you to make sure you don't overpay. So again, these plans are standardized. They're all the same. Private insurance companies offer them. So you need to be careful when shopping for a Medigap plan to make sure that you're not overpaying and with the wrong company. So Medigap plans are also what's called guaranteed renewable. Again, doesn't matter which plan letter it is, but guaranteed renewable means that as long as you pay your monthly premium, they can never take the coverage from you. It doesn't matter how many health claims you have, what amount maybe you cost the insurance company. None of that matters. Just pay your monthly premium and you have your policy for life if you need it. But Medicare Supplement plans also have what are called rate increases every year. And what that means is they're going to go up slightly based on a number of factors, inflation and age, the most common factors. But they can never raise your rates based on your own health claims. It's based on the group you're in. So you can expect rate increases every year. As long as you pay your premium, they will never take the policy from you. Now, we shop the rates every year to make sure you're not overpaying because you do get those. We save our clients as much money as possible every year. So I'll be going into detail about the Medicare supplement rate increases specifically on Plan G here in a moment because it's an important variable. However, let's do a little recap. What does Plan G cover? Well, it covers 100% of the gaps in Medicare Part A and Part B after you simply pay the Medicare annual Part B deductible. That is $240 in 2024. 2023, it's $226. So it does change a little every year. Like most things, it goes up every year, and it's doing that this year. But after the $240 is met, 100% coverage. I've had clients, in fact, I just recently spoke to one, had a heart attack and had to get major surgery. And with all the recovery and that procedure, his Plan G, he texted me from the hospital, said, thank God I have Medicare Plan G. What's my total bill again? And I said, it's going to be $226 because it happened in 2023 this year. 2024, I said if it happened then, it would be $240. Go get well. Focus on getting well. Don't stress about your medical bills. That is the beauty of Medigap insurance. Nobody's going to be coming in your room and saying, well, we have to get prior authorization for this, like often happens on a Medicare Advantage plan. That's a fact, folks. With a Medicare supplement plan, if you want the convenience and the peace of mind in knowing your medical bills are going to get paid and an insurance company is not in charge of what will be paid or not, then a Medigap plan is the way to go. And of course, Medicare Supplement Plan G with one small deductible, then 100% coverage. That's some great peace of mind. Now, this is usually the part of the program where most people are saying, gee, Russell, that sounds a little bit too good to be true. What's the catch? Well, there is no catch. It really is $240 in 2024 and then 100% coverage up to no limit for all Medicare approved expenses. However, Medigap plans don't cover prescription drug coverage. You've probably heard of a Medicare Part D drug plan. Well, those are put out by private insurance companies regulated by Medicare to offer now what is going to be very inexpensive, at least for the monthly premiums, for Part D drug plans in 2024. There are a lot of different options available, especially in all the parts of the country. But Medicare supplement plans also don't cover dental, vision, or hearing, but we've got options, great options for those separate policies that you can enroll in. So let's take a moment to talk a little bit about the cost of Medicare Plan G. Now that I've hopefully convinced you it is real, and that is really the coverage, the next question on your mind might be, well, geez, how much is this going to cost me? It's got to be crazy. In reality, it's not. On average, Medicare Plan G may cost about $125 a month. However, Every company sets the rates based on different factors. Now, those are zip code. If you live in Florida, it's going to be much more expensive than Iowa. That matters. Gender, age, and tobacco use, but also if you qualify for any household discounts or not. Now, you can see the rates for Plan G as well as another plan I'm about to talk about, so stick around. You're going to want to hear this. You can see the rates for those plans on my website for free at Medisupps.com. There it is. Medisupps.com. You can go to my site and check the rates for free. I'm one of the only people out there that does this. People say I'm crazy. How could you show the prices to everybody for free? Don't you want to have them fill out all their information and then you call them? Well, no. If I'm going to say I'm actually showing you rates and quotes, unlike just about everybody else out there, I'm going to show them to you. Imagine that, just being honest. I've been doing this 15 years, folks. I just want to help you out. You have to work with an agent to sign up for Medigap coverage or any Medicare coverage. Even if you call the company direct, you're talking to one of their agents. And if you do that, again, you're going to be just talking to them and they're going to try to sell you that one company. So in your process of having to choose an agent, we would be grateful, very grateful, if you allow us to help. That's all we do. We help people all day long. And again, you can see those rates on my website for free. So I did promise you another option that I am really excited about and have been for quite some time, many years in fact, and that is Medicare Supplement Plan N. Now I know this is a Plan G video, but you need to explore all of your options in the easiest way possible, and I don't overcomplicate things. You can watch all my other videos, and I'm known for the guy who makes it very easy to understand. Medicare Supplement Plan N, another option to Plan G, very close in coverage. However, it averages about $30 to $50 less in many cases, less per month in monthly premium. Now, why is that? Is it not good coverage? Well, no, it's very close. However, there are a few items you need to know about and the differences to help you decide, and of course, we can help you decide as well. Plan N, again, that lower monthly premium. How it works is Plan N, you come in and you pay the same Medicare annual Part B deductible of $240 for 2024. After which, Medicare Part B comes in, pays 80% of your medical bills. Plan N will pay the 20% for the rest of the calendar year, just like Plan G. But the difference is with Plan N, you might have up to a $20 copay per doctor's visits after you meet the deductible. So meet the deductible, $240, revisit the doctor that calendar year, you might be billed up to $20 for the visits. Now, if you're saving $30 to $50 a month in premium and you go to the doctor and it's a $20 copay, well, depending on how many times you go to the doctor per year, that could be big savings right there. But there's a couple other options that come up with Plan N that you might have to pay a little extra for. One of them is if you visit the emergency room and you have a Plan N, and you're not admitted, there will be a $50 copay. And that's just to keep people out of the emergency room for small items. So it's actually a good thing because when there are additional expenses in a group, you're in a group with your Medicare Supplement Plan, and people know they'll have to pay money to use their coverage in the form of copays, for example, they use it more responsibly. That helps with rate increases, and I'll get to that in a moment. So emergency room, you visit the emergency room and you're not admitted, a $50 copay. There's another thing that Plan N doesn't cover. It's called Medicare Part B excess charges. Now, 98% of the doctors in this country do not charge them. Now, there's a list of states, 8 states next to me, that they're not even legally allowed to charge them. So if you're in one of those states, boy, we really want to talk about Plan N to save you money and get you extremely comprehensive coverage. However, if you're in a state that is not on that list, and you visit a doctor that does not accept the assigned rates from Medicare, meaning a non-participating doctor, they can charge up to 15% extra of what Medicare normally would charge. You would be responsible for that if you had a Plan N. And it could average very low, sometimes even less than $20, but they're very rare anyway. They're very rare to see a Part B excess charge because 98% of all doctors don't even charge them. Now, you can visit Medicare.gov or call your doctor to see if they accept the assigned rates from Medicare. Chances are they do, and Medicare Supplement Plan N just might be a great option for you. And while we are on the topic of Plan N, let me get back to those rate increases. Now again, regardless of the Medicare Supplement Plan letter, each company's probably going to have a rate increase each year on your anniversary. It's not necessarily on your birthday, although if you started your policy on your birthday, that's when it would most likely come up, not always. Medicare Supplement Plan G is offered in a number of cases of what's called guaranteed issue. And this might be if somebody's coming off employer group coverage in specific circumstances and they have significant health benefits where they normally wouldn't be able to qualify through what's called medical underwriting and be approved for the policy, they can, in many cases, get a Medicare Supplement Plan G guaranteed issue. How that affects rate increases, the insurance company is not allowed to decline them the policy. They have to accept everybody in those cases to a Medicare Supplement Plan G. And what that does is, if you've got a lot of unhealthy people that they couldn't vet out, that will cause more health claims because they're more unhealthy. They're visiting their doctor often, which would increase rate increases in some cases or has a potential to have higher rate increases. Medicare Supplement Plan N, on the other hand, is never guaranteed issue. You can't just waltz in and, regardless of the circumstance, and get a Plan N unless you're open enrollment, which is when you're first taking Part B Medicare. So many cases, Plan G might have slightly higher rate increases than Plan N, in some cases very much higher. We've seen it, depending on the area of the country, we've seen them be close in low rate increases, but on average, I would say that Plan G is higher with their their annual rate increases than Plan N. So that's just another benefit to Medicare Supplement Plan N where there has a greater potential to having lower annual rate increases. So without confusing you, like I mentioned, you might be saying, well, Russell, how do I choose? Well, let me give you this little example. If you have Medicare Supplement Plan N, again, they're very close in coverage. You still pay the Part B deductible with both plans, and you visit the doctor once per month, and you get the full copay of $20, you will still end up saving money on Medicare Supplement Plan N. And you will have those lower monthly premiums. Maybe you don't go to the doctor once a month. That's quite a bit, actually. There's some people who go more and less. But if you don't go to the doctor often at all, particularly if you're in one of those states that doesn't have those Part B excess charges, boy, I would really encourage you to allow us to help and look at those premiums for Plan N. I have my own mom on Plan N, and I have since 2010. She absolutely loves it, and her premium is still relatively low. And she tells me she's never seen a copay. I don't know. Maybe. I don't know. I'm going to believe Ma. You got to believe Ma, right? Well, again, choosing which plan, at least you've got some options now. Plan G, great coverage. Plan N, also great coverage with a couple different cost-sharing options. The easiest way to get started, however, is to call the phone number down below. We would love to talk with you. My top agent, Diana Firth, and I have helped thousands of people. We've been doing this a long time. It's very easy for us to check out your own situation, check the rates in your area, and make sure you don't overpay on your coverage and you're in the right plan to fit your needs and budget. So give us a call today. We'd love to speak with you. I promise you'll be glad you did.